Hi, this is pharmacist Curtis Alexander. In this video, I'm going to talk about the medication Gilenya, just give you a 35,000 foot overview of its uses, side effects, those sorts of things. This is part of our 101 series on these medications. Before we get into it, if you enjoy this video, I'd appreciate a thumbs up. Also subscribe if you want to see more videos like this on medications and supplements from a pharmacist. So real quick, jumping right into Gilenya. So basically what we have is, it's an MS drug, so multiple sclerosis. I'll just call it MS from this point forward. It's easier to say. There's a few different types of MS, the relapse, remitting, the secondary progressive, and the clinically isolated. It's approved for all those. As far as mechanism of action, what we believe Gilenya does, there's lymphocytes that can get into the nervous system essentially, and Gilenya goes in, decreases the amount of lymphocytes that we see, which in turn can decrease the amount of inflammation that we see in the central nervous system, which we believe relates to the symptoms that people see with MS. Now the downside of that is inflammation is part of one of the first steps in the immune response. So when you knock that down, you can have side effects, which we'll get into in a little bit. So Gilenya comes in a 1/2 or 0.5 milligram strength. You just take one of those a day, with or without food, it doesn't matter. What we do know is that there's no benefit to increasing the dose, and that actually if you do increase the dose, the risk of side effects goes up substantially. So no benefit and more risk to trying to increase the dose. So we just keep it one tablet a day on that. What we do, if someone, we really want to watch people when they take Gilenya, the first dose or so, because you can see a decrease in the heart rate. And so we want to keep an eye on people. That's one of the side effects, and we'll get to that. So keep in mind that the doctor may let you know that, listen, when you take the first dose, we want somebody to keep an eye on you. There's also a 14-day rule, I guess, more or less, for Gilenya, where somebody's off it. If for some reason they're off it for 14 days, same thing applies. They'll want to watch that person when they take their first dose. So now, as far as the side effects, we alluded to it earlier. The most common one by a pretty big margin is headache, with up to 25% of people experiencing a headache. We can see an increase in the liver enzymes. We can also see gastrointestinal side effects. So they're going to be monitoring your labs while you're on it, but the increase in liver enzymes, you can see that in like 15% of folks. Same sort of incidence with the GI effects, the nausea, diarrhea. Around 10 to 15% of people can experience that. Cough can happen in around 12% of people, and then we actually have an incidence of people developing influenza, around 11% of those people. So again, the bradycardia, which is what they call the low heart rate, headache, the stomach side effects, as well as the infection rates we need to keep an eye on. If you have a history of a heart attack or a stroke, something along those lines, they're probably not going to want to put you on Gilenya. In fact, it's a contraindication. It's something that you cannot do in those folks. I get asked, I mention this in a lot of videos, I get asked, does this cause weight gain? Will this cause hair loss? Those are two side effects that are important to people. As far as hair loss, it actually has been reported in upwards of 3% of users, so that is something that you want to keep an eye on. As far as weight gain, that was not seen. I think that you're most likely to see weight loss, because again, remember, we have your infection risks do go up, so people generally, if they have an infection, they're not feeling as well. Also, we have those GI side effects, the nausea, diarrhea, so people tend to, if anything, lose a little weight on Gilenya. Last but not least, Gilenya is expensive. So I'm going to include a link in the description to the manufacturer of Gilenya, to their website, where they have financial assistance. You may or may not qualify. It depends on if you have insurance, what that insurance is, so on and so forth. But it's a good place to start, and then you can kind of go from there. So again, pharmacist Curtis Alexander, this is Gilenya, and I hope this video was helpful. I appreciate you watching. Any questions, post them in the comments. I will do my best to answer them. I'd also appreciate it if you have any experience with Gilenya, if you know somebody who's taken it or you've taken it, post in the comments, let me know how that went. I'd appreciate hearing more, as well as other people who watch this would appreciate it. So until the next video, thank you again.